Aloha and welcome to the Hawaii State Senate Committee on Health. I'm Senator Jared Keohopolole, Chair of the Health Committee. I'm joined here today by my fellow Health Committee members, Senator Roger Baker and my Vice Chair. We also have Senator Kirk Favela, Senator Joyce San Buenaventura, and probably about to come on is Senator Sharon Mori-Walkie. This meeting is being streamed live on YouTube. In the event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Monday, February 7th at 1:10 p.m. And a public notice will be posted on the legislature's website. For testifiers participating remotely, your audio will be muted and video disabled until shortly before it is your turn to testify. We ask that you please limit your testimony to 2 minutes. We have received all of the written testimony, and I have reviewed everyone. So I'd encourage you to use your time to either add additional testimonial remarks or make specific points you'd like to within the 2 minutes. I'll be reading from a list of individuals who submitted written testimony. We apologize if the closed captioning doesn't accurately transcribe your name. And members, just so you know, we'll be DMing that last measure from Wednesday immediately after. So first up, we have SB 2280 relating to dental assistance. This allows dental assistants to perform limited duty under general supervision of a dentist in public health settings. Where did I put my file? Okay. Excuse me. First up, offering comments, Department of Health.
Good afternoon. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department stands on its written testimony, providing comments and offering an amendment. I'm here to answer any questions. Thank you.
Thank you, Mr. Shim. Next, we have the Department of Health again. Is that Andrew Sue? Okay, Board of Dentistry. Oh, Andrew, go ahead. Please unmute when you're ready. Can you please unmute?
Okay, I apologize, Chair. My name is Andrew Zale. I'm with the Department of Health, and I'm here to answer any questions regarding this bill and the amendments also. Thank you.
Okay, thank you very much. Next, we have the Board of Dentistry offering comments.
Aloha, Chair, Vice Chair, and members of the committee. Sandra Matsushima, Executive Officer for the Board of Dentistry. I stand on our testimony providing comments. Thank you.
Thanks very much. Next, we have the Hawaii Oral Health Coalition in support.
Hi, good afternoon, Chair Keohopolole and Vice Chair Baker and members of the committee. My name is Patrick Donnelly. I'm the statewide Oral Health Coalition Manager for the Hawaii Public Health Institute. We'll stand on our written testimony in support of the intent of this bill with proposed amendments to some of the language. Thank you very much.
Thank you. That's all the testimony we received from individuals who registered. Is there anyone on the call that we might have missed? Okay, seeing none, I'd like to note the written testimony, all in support of the following individuals and organizations: the Hawaii Children's Action Network, the Hawaii Dental Association, the Hawaii Dental Hygienists Association, Hawaii Dental Service, Hui no Keola Pono, and Vizdak, Jennifer Logigian, Paul Glassman, Robin Cheek, Stephen Pine, and Leanne Higa. Members, any questions? Okay, we'll move to the next measure. This is SB 2439 relating to hearing aids. This requires health insurance policies and contracts issued after December 31st, 2022 to provide coverage for the cost of hearing aids at a minimum of $1,500 per hearing aid for each hearing impaired ear every 36 months in their base plan. First up, we have the insurance commissioner, Mr. Hayashida.
Good afternoon, Chair Kehoe Kolole, Vice Chair Baker, and members of the committee. My name is Colin Hayashida. I'm the Insurance Commissioner for the Department of Commerce and Consumer Affairs. The department stands on its written testimony offering comments on the bill. And I just like to add just a clarification that the 2014 auditor's report on hearing aids was studying a different bill at that time from the current bill that we are looking at today. And that is why that language on the auditor's report is included in our testimony. Thank you for the opportunity to testify today.
Thank you very much. Next, we have HMSA in opposition.
Aloha, Chair, Vice Chair, and committee members. Matt Sasaki with HMSA. We've submitted testimony on this bill. Would like to quickly note two things: that by setting a minimum dollar coverage threshold for hearing aid, you may potentially be creating unnecessary medical spend. Rather, we may recommend that you want to focus on the functions of the hearing aid, such as analog or digital. And additionally, one other point I'd like to note is that Medicare plans are preempted by federal law from any state mandated coverage. So the intent of this bill may not be able to cover the intended population. I'm available for any other questions. Thank you, Chair.
Thank you very much. Next, we have Sherry Shimizu in support. Eleanor McDonald in support.
I believe Sherry Shimizu is on, isn't she?
She just came on, and I'm the
Sherry, I
interpreter
see
for her.
you. Sherry, I see you. Please proceed, followed by Eleanor.
I have just 2 minutes, correct?
Yes.
Okay. My name is Sherry Shimizu, and I graduated from Pearl City High School. And then I got my bachelor's of science degree in Rochester Institute of Technology in New York. I majored in packaging science, which is better known as engineering. And I also have a minor in criminal justice. I'm a resident of Pearl City. And I'm testifying today because I really want to express my very strong support for SB 2439, which will mandate coverage for hearing aids. This bill is really important to me personally because I've been deaf in one ear and hard of hearing in the other for my entire life. And I use one lateral hearing aid and decided to stop about 5 years ago. Hearing aids are very expensive and I cannot afford new ones. And similarly with my family members and friends, my parents, siblings, and other family members are also either hard of hearing or deaf. And I know firsthand the frustrations of missing information because I did not hear it clearly. And I know firsthand how much hearing aids can do in accessing information that I otherwise miss. And I know firsthand how it feels to be told, pay attention, when I did everything I possibly could just to be told, oh, never mind. Adjusting to changes in my hearing over time makes this a lifelong challenge. And I know too how expensive hearing aids are and the challenges in finding and getting the most suitable aids for my own use, as well as the time seeking out qualified Okay, okay. I'm just in strong support of this bill, please. Thank you.
Okay, thank you very much. Next, we have Eleanor McDonald.
Aloha, I'm Eleanor McDonald. I enthusiastically support SB 2439 to mandate health insurance companies to cover the cost of hearing aids for children and adults, but especially for seniors and elderly people. I define seniors as people 55 to 69 years old and elderly as people 70 years old and over. I fall in the latter category. Many of us have worked hard all our lives and are now retired, and many are unable to afford these expensive hearing aids to continue to be in touch with family and friends. When you cannot hear well, you stop going out with friends. Don't talk too much when your family gets together because you get lost when so many people are talking, and slowly you withdraw and isolate yourself. This slowly results in the auditory cortex of the brain to atrophy, and slowly our independence is affected. This bill addresses these issues. Please pass this bill. Thank you very much.
Thank you very much. Next, we have Peter Fritz.
Sorry, Chair, I'm not used to remembering to turn on my microphone. My name is Peter Fritz. I'm a hearing aid user. I've supported this bill in a number.
Are you able to engage your video? Oh, I think.
Yeah, I just did. Well, it's on.
Okay, well, you can.
No,
okay,
thank
there we
you.
go. Okay, go ahead.
You know, I'm a Luddite. I'm not one of those real technically sophisticated people, so I'm doing my best. Anyhow, my name is Peter Fritz. I'm a hearing aid user. I've supported this bill in many times. My testimony refers to certain studies by Lancet, as well as a journal of the American Medical Association regarding the benefits of providing hearing aid benefits. One comment that was in my testimony was it's probably the biggest single thing that can be done to help prevent dementia, which is providing hearing aids. I note that in the auditor's report from 2014, they mentioned that in 2015, that many hearing aid policies, many insurance policies already provide hearing aid benefits. We haven't heard from the insurance companies about just how many policies would be covered and have to make changes in order to make this, as well as anything responding to the studies by Johns Hopkins that talks about how hearing aids can help prevent people getting injured. I use hearing aids. I'm covered by Medicare. I won't get any benefit from this bill, but I do know the benefits that will come forward by allowing people to participate in society, to follow things that they can't follow, and be part of the community. It will reduce isolation. So if we look at the benefits of this bill, the benefits and the cost of this bill, the cost of providing hearing aids may actually reduce the cost of providing insurance coverage or paying for benefits for people that don't have hearing aids and suffer injuries. And there are statistics in my testimony pointing to a study at Johns Hopkins that talk about the increased incidence of people that don't have hearing aid corrections compared to those that do, and how they have a greater incidence of needing medical care. So I respectfully request that this committee move this bill forward, and thank you for the opportunity to testify.
Thank you, Mr. Fritz. Next, we have an individual named Nikki in support.
Hi, aloha mai. This is Nikki Kipo'o. Trying to get my video on, but it doesn't seem to be working. Is it okay if I proceed?
Yes, go ahead.
Okay, so hi, aloha. My name is Nikki Kipo'o. I'm calling in support of this bill. I'm going to give the perspective of a parent with a hard of hearing child. My child is actually deaf, but I do advocate for other families within the deaf, hard of hearing, and deaf blind community. One of the largest things is financial impact to our families. When our children are born and identified as being hearing impaired, a lot of the expenses are on the burden of the family. And as our children grow, their ears will change sizes. So ear molds are actually changed probably every 4 to 6 months. from birth until, I'm not sure what the age is, but you can imagine how expensive it can become over time in trying to get them molded and also fitted for these hearing aids. So this bill, in providing some assistance to these families, can alleviate that stress when a lot of our focus should be on the education and academics of our kids. So I'm asking if the board can, or committee can please pass this bill and give full support to this measure. Thank you.
Thank you very much. That's all the testimony we have from individuals who were registered. Is there anyone else on the call who would like to testify on this bill, SB 2439? Okay, members, questions? Okay, I have a question for, I guess, Mr. Fritz. Are you available?
Yes, sir. Let me figure out how to turn on my video again. Thank you. Yes, sir.
Okay. Do you have a comment on the testimony from the from HMSA around amending the standard from a hard number to medical necessity?
I think whatever standard is in there is going to be part of their policies. And when I was covered by HMSA, it was in my policy, and I did receive a benefit of $600 per hearing aid. So medical necessity, that's really a question. So I think that it's either a benefit under the policy or it's not. And the policy decides what medical benefits, what's a medical necessity to begin with. So without reading their full policy, I don't know that it would be necessary, because their policy isn't going to let anybody select anything that they want. So their policy will govern. Does that address your question? Somewhat.
I think so. Thank you.
I haven't read their testimony, sir.
Yeah, it's basically the suggestion was changing the $1,500 minimum standard to medically necessary hearing aid models with standard features. So I was just wondering if you or any of the testifiers who utilize the devices would have an opinion on that amendment versus the minimum hard allocation.
I do have a partial comment, and that comment is that there was a change in some of the medical rules governing over-the-counter hearing aids, and that's why you see more and more ads. For a while, they couldn't be advertised. The problem is that if you buy them over the counter, there's no medical coverage for an audiologist to adjust them. And so I have to think that it's going to be something similar to all the comments we hear about young people playing their stereo too loud, with people now purchasing an over-the-counter hearing aid. So I'm not sure what they mean by medical necessity and if that's what they're driving at. So if they're saying somebody purchases a hearing aid that's, quote, one of the over-the-counter ones, is that medically necessary? Should we be required to pay for an audiologist to go and hear them? Medicare won't pay for it right now. So again, I don't have enough factual background to be able to answer your question thoroughly without looking at the policy and without understanding if they're talking about hearing aids that are dispensed by an audiologist versus hearing aids that are purchased over the counter.
Okay, thank you, Mr. Fritz. Mrs. Sasaki, are you on? Could you respond to that? I'm trying to understand this.
Yes, thank you, Chair, and thank you to Mr. Fritz as well. I cannot comment right now on the OTC hearing aids. That's still something that I think there's quite a bit of traction on. But specific to medical necessity, we do have policies in place that provides coverage and a benefit for hearing aids in relation to the medical necessity in conjunction with the member in question and their provider who is prescribing the hearing aid. Our comment in regards to removing the minimum coverage is to rather focus on the function in respect to that person, because we do know that every person's needs for a hearing aid probably differ across each member. And we just want to be mindful of that and leave it to the provider to help determine what the need is at the time.
Okay, thank you. Members, any other questions? Vice Chair.
Thank you. I'm just curious if there's any way to gauge how often a hearing aid would need to be changed because the hearing would get worse. Because we're saying a minimum of 15 for each hearing aid every 36 months. Is that a good standard to use? Can any of our medical people or folks, or Peter who uses hearing aids, answer that question?
Again, I'm slow turning on the video, which I apologize. I do have some experience with hearing aids over a period of time, and it's Hawaii and it's humid. It seemed like every 36 months, I ended up sending a set of hearing aids in to get them repaired because the humidity used to be a problem, although my last ones have lasted longer than that. I think if you talk to many people, you'll find 36 months may be, based upon the layman's perspective, a good period of time for replacement. It's not so much replacement because your hearing changes, unless you're dealing with children that need new ear molds. But for older people, it seems like if we take care of them and we put them in a dryer box every night to try and get rid of the humidity, 36 months is a pretty good time for hearing aids to last without having a whole lot of problems. Again, that's my experience. I cannot speak for anyone else.
Thank you, Chair.
Okay. Any other questions, members? All right, then we will move on to the next measure, which is SB 2440 relating to tobacco use disorder treatment. This requires facilities providing treatment for substance abuse disorders to assess patient or client for use of all tobacco products at the time of their initial intake and take certain actions if the patient or client is determined to have a tobacco use disorder, effective July 1st, 2023. First up, we have the Hawaii Substance Abuse Coalition in opposition.
Good afternoon, Chair and Senators. Alan Johnson with the Hawaii Substance Abuse Coalition. Yes, almost all states now have reversed all restrictions on smoking in substance abuse and mental health. I think Arkansas is the only state still remaining, and that's because it's become a barrier to treatment and huge numbers of people didn't come in. And so that's why that trend is going. I mean, if people are having a chronic substance abuse or mental health problem, if they make to the residential, that's severe, and they're coming because their life's unmanageable, or they may feel their life may end. They're pretty motivated. They're not coming because they want to quit smoking. And mandating that gets to be a real problem for them, and a huge amount of them do smoke. And so that is a concern for us, but mandating becomes a barrier. So what we're saying is that the Hawaii Substance Abuse Coalition, we've joined the Hawaii Tobacco Coalition as a member, and we've been implementing screening and voluntary practices. Now, I admit that the numbers aren't huge, that the ones who volunteer, but it's a volunteer program we have. And so, but we're making progress, and we're working through that because we do want them to quit smoking, but we don't want it to be a barrier that they don't access services. Thank you for the opportunity to testify.
Thank you very much. Next, we have the Hawaii Public Health Institute in support.
Good afternoon, Chair, Vice Chair, members of the committee. Amanda Fernandez, Policy and Advocacy Director with the Hawaii Public Health Institute. We support this measure, and we appreciate the committee's attention to the issue of nicotine addiction among people struggling with substance use disorders. We know that smoking rates are 2 to 4 times higher among those with mental health or substance use disorders. And we believe that offering tobacco cessation interventions in substance use treatment facilities could decrease tobacco-related disease and death and contribute to the success of substance use treatment. We appreciate the opportunity to testify today, and we hope that you pass this bill. Thank you.
Thank you. That's all the registered testimony we have on this measure. Is there anyone I missed? Okay, members, questions? Senator San Buenaventura.
Thank you. For Alan Johnson, are you there?
Yes,
so,
hi.
Hi, when I read the measure, it doesn't actually mandate that you folks counsel them to stop tobacco but basically to give them, to assess and give them information and send. So knowing that it's just an assessment and giving them information, but not actually treating them.
It says in there, treat or refer to, and then it becomes referring to. That means we have to put them in a van and then take them over there to refer to, or make arrangements to come in. The Department of Health does require some screening. So if you get state funding, you're already doing that. Education is included in some of the group, but in our outpatient facilities, that there's 3 hours a day of group, and it's not, you get some information and then you're told where the referrals are, but it's not a part of the program because you only got 3 hours to do the treatment on. So the outpatient programs, it gets to be kind of a problem for us trying to fit it in. And we're really required on regulations what those 3 hours has to be. So that becomes a problem where there's more time in residential. For Hinamalka, we don't like the idea of being mandating, and that we don't like that the clients don't understand what it always means, and that our staff have to say, well, we're required to do this for you and provide this education to you. And they don't always interpret that really well when they're going through their cravings and all their problems. When we talk to them about, hey, this is a volunteer program and we're working on it, they kind of relate to that much better. Because you got to remember, especially if you're on meth and coming off of that, your memory's not good, your cognitive functions aren't too good. They don't really understand all of that. And so we're saying that's just really a problem for them. So,
okay, yeah, thank you very much. And I guess I interpreted an offer of either treatment is not a mandate, but the description does say mandate, even though the actual statute to me, bill, doesn't. Anyway, it's something that we can discuss off within the committee. Thank you very much.
Hey, thank you. Thank you very much.
Members, any other questions? Okay, I'd like to note for the record that there were 8 individuals or organizations that submitted written testimony in support, and again, the Hawaii Substance Abuse Coalition in opposition. And I'd also like to note for the prior measure, SB 2439, there were 14 individuals or organizations that supported the measure, 2 that opposed them, 2 offering comments. The next bill on the agenda is SB 2460, relating to nurses. This allows for temporary permits to be issued to registered nurses and licensed practical nurses from a territory or foreign country that are seeking a state license by endorsement. First up, we have the Board of Nursing offering comments.
Good afternoon, Chair, Vice Chair, and members of the committee. Chelsea Fukunaga, Executive Officer of the Hawaii State Board of Nursing. The board will stand on its written testimony offering comments on this measure. Thank you.
Thank you. HMSA in support.
Aloha, Chair, Vice Chair, committee members, Matt Sasaki, HMSA. We've submitted testimony in support of this bill, and just want to note that expanding access to qualified healthcare professionals is important to our overall community of health. And I'm available for any questions. Thank you.
Thank you. Hawaii State Center for Nursing offering comments.
Hi, good afternoon, Chair Kehokolole, Vice Chair Baker. Thank you very much for hearing this measure. The Center for Nursing stands on our comments and are available for questions.
Thank you very much. Queen's Health Systems offering comments.
Hello, Chair, Vice Chair, members of the committee. I'm John Garibaldi with the Queen's Health System. We're going to just stand on our written testimony providing comments. Thank you.
Thank you very much. Patricia McManaman in support.
Not present,
Okay,
Chair.
that's all the registered testifiers we have for this measure. Did I miss anyone? Okay, I'd also like to note the following individuals submitted written testimony: the Hawaii American Nurses Association in support, Hawaii Coalition for Immigrant Rights in support, Hawaii Pacific Health in support, the Filipino Advocacy Network in support, the Healthcare Association of Hawaii in support, Matt Bishop in opposition, and the following individuals in support: Corey Park, Thaddeus Pham, Denise Cohen, Liza Ryan Gill, Elena Kabatu of the East Hawaii region of HTSC, and Lori Field of Planned Parenthood Alliance Advocates. Members, are there any questions? Okay, next measure is SB 2592. Relating to health, this defines clinical laboratory director to include certain physicians, licensed clinical laboratory science, and pharmacists in charge of pharmacies. It amends the definition of practice of pharmacy to include the ordering and performing of certain clinical laboratory improvement amendments, waived tests. Okay, Department of Health.
Good afternoon, Chair Kehokalole and Vice Chair Baker and members of the committee. This is Keith Ridley on behalf of the Director of Health, submitting comments on this bill. You do have our written testimony, and I just want to emphasize that we do have quality concerns. And I also wanted to inform the committee that of the approximately 167 pharmacies in the state of Hawaii, approximately 37 of them have CLIA certificates and state permits to do lab testing. Now, not all pharmacies do lab testing. The smaller pharmacies, for example, in the Targets and those kinds of places, don't have the space for doing testing. So there are a number of the pharmacies that are already going through the regulatory process to obtain the CLIA certificate and a state permit to do testing. We think that should continue. But you have our comments, and I stand available for any questions you may have. Thank you.
Thank you very much. Next, we have the Board of Pharmacy offering comments.
Good afternoon, Chair and committee members. I will stand on our written testimony, and we'll reach out once the board addresses this measure next week.
Thank you very much. Hawaii State Center for Nursing offering comments.
Good afternoon, Chair and Vice Chair. I just want to recognize that APRNs are currently fulfilling the role of CLIA Waive Director. They have authorization for this practice and are working with the Office of Healthcare Assurance. And as such, should this measure go forward, I ask for your consideration to include listing other licensed healthcare providers, and so that APRNs can continue this service. Aloha.
Thank you very much. The Hawaii Pharmacists Association in support.
Good afternoon, Chair, Vice Chair. My name is Corey Sanders. I'm the president of the Hawaii Pharmacists Association. A couple comments just about the simplicity of the CLIA Waive tests, and then how pharmacists have already been utilizing CLIA Waive tests as leveraged by the PrEP Act since it was enacted with COVID. So again, the simplicity of the tests, just the nature of their design in and of themselves are approved on the basis that they are going to be easily navigated by a layperson, and nonetheless a professional that has 4 years of extensive amounts of training. And I also want to articulate, we are one of the few states across this country where this barrier still remains to have a relationship with the laboratory director in order for a pharmacist to perform a CLIA Waive test. And again, we are performing these tests, at least a few of them as enacted by the PrEP Act during COVID-19, and it would be advantageous for the population health at large to be able to continue to perform these tests after the national state of emergency drops off and we are no longer granted these abilities through the PrEP Act. In terms of the amendment, we support the change of pharmacist to pharmacist in charge, and we also support negating the list of tests that's included in the bill and rather just allowing all CLIA Waive tests so that for future tests that are designed, we're properly leveraged to utilize them as they are put on. But thank you for this opportunity.
Thank you very much. Next, we have Walgreens in support.
Good afternoon, Chair, Vice Chair, committee members. Mihoko Ito with Sanhai Government Strategies on behalf of Walgreens. We are in strong support of this bill for many of the reasons that were just stated by the previous testifier. We would also concur with the proposed amendments and have outlined those in our testimony as well. And just to address, the safety concerns that are raised by the Department of Health, the crux of this issue is really that on the current application for CLIA Waive testing, The requirement is for a pharmacy to contract with a laboratory just to have somebody sign off on the application. This is an administrative requirement that does not exist in other states and does present a hurdle to getting these tests, easy access to these tests in pharmacies. So we support the measure and support the proposed amendments, and we ask you to move the measure. Thank you.
Thank you very much. That's all the registered testimony we've received. Is there anyone else on the call who'd like to testify? Okay, I'd like to note the written testimony in support from the following individuals and organizations: Times Pharmacy, the Hawaii American Nurses Association, Alana Isobe, Ronald Taniguchi, Thaddeus Pham, and Carolyn Ma. Members, any questions? Okay, we'll move to the next measure, SB 2751, relating to health. This expands the Hawaii Health Corps program and Hawaii Rural Healthcare Provider Loan Repayment Program to include incentives for psychologists and social workers. It makes the Department of Health responsible for administering the Hawaii Rural Healthcare Provider Loan Repayment Program and appropriates funds. Okay, Department of Health offering comments.
Good afternoon, Chair Kehokalole, Vice Chair Baker, members of the committee, Lauren Kim, Policy Officer for the Department of Health. The department submitted comments, and I'd like to highlight a couple of issues. We already have an existing loan repayment program that is well run and very successful. JABSOM is the steward of that program, and we think that they should continue to coordinate any state loan repayment program going forward. The department is a partner in that endeavor. And we are definitely at the table, but we are not well suited to run a loan repayment program. The second point I'd like to make is that the Hawaii Health Corps law that's on the books was unfunded. And the current Hawaii State Loan Repayment Program uses matching federal funds. So we have two programs, one established in statute and the other just exists as a project in JABSOM. So if this measure moves forward, we may have competing programs for the same resources. We respectfully recommend that the bill be amended to an appropriation that matches the request from JABSOM. Thank you, and I'll be available for questions.
Thank you. University of Hawaii in support.
Aloha, Chair, Vice Chair, members of the committee. My name is Kelly Wiki. I'm JABSOM faculty and I administer the Hawaii State Loan Repayment Program. We love loan repayment in any form, but we think together we can do more. So we do cover social workers, psychologists, and I don't want to put too much work on Lauren's plate, you know. Anyway, I'm going to stand on our testimony and answer any questions.
Thank you very much. Next, we have the Hawaii Psychological Association in support.
Aloha, Chair Hokalole and Vice Chair Baker. I'm here, Becky Garter, on behalf of Hawaii Psychological Association. We stand on our written testimony in support. Thank you.
Thank you very much. That's all the registered testimony we have for this. Did I miss anyone? Okay, we also have written testimony in support from the Hawaii Primary Care Association, the Hawaii Substance Abuse Coalition, and the National Association of Social Workers Hawaii chapter. Members, any questions? Your hand came up at the exact same time. Senator San Buenaventura.
So who
Joy, you can go first.
Yes.
Thank you. So I'd like to speak to the last witness, Ms. Gardner, who testified in support of the bill. Aloha.
Hi, Senator.
So my question is, basically what the Department of Health and JABSOM was testifying, why transfer the loan repayment program from JABSOM to Department of Health?
To tell you the truth, honestly, this is new information to us. So we haven't had a chance to discuss with our membership our position. We defer to the wisdom of the committee on what's the most appropriate way to handle the funds.
So you're basically testifying regarding the loan repayment itself and not.
Yes, and in general, whatever we could do to improve ways we can meet the demand for quality mental health services.
Thank you so much. So, Chair, I don't know of any live witness that could answer that question as to why why the bill transfers it. Okay, but anyway, so thank you. I don't have any other questions.
Okay, Senator Moriwaki.
My question has to do with the two programs, similar to Senator Zandvo and Ventura, but it's in terms of what does the Department of Health do and what does JABSOM do, and why are there two separate? Because I think I go back to Lauren, you know, that if there are two separate programs operating, you're competing for similar resources or maybe same resources. How might we work together so we have the expertise of both? Is it one program that can be, you know, both can be consolidated, or how would you proceed?
Well, thank you for that question. I'd like to start the conversation off and then suggest that Dr. Withy supplement my comments. So the amendments to the statute in this bill are for an unfunded program. I think it was Senator Green back in the day and Chair Yamane that pulled this together. I think Senator Baker may have had a role in this, but ultimately it wasn't funded. It was a great idea. And it was just coincidentally that the feds came out with a low payment matching fund program that Dr. Withy's cadre took advantage of. So the reality is JABSOM runs an excellent loan repayment program that already includes psychologists and social workers. Kelly can give you reams of data to show that it is having its intended effect. We all know that where you do your residency greatly influences your likelihood to stay. Kelly has those numbers. We are at the table. We are an equal partner. But JABSOM basically administers. They are the loan repayment people. So on paper, it is this program, the statute. In reality, it is Dr. Withy's program, and they should be in the lead. The department does not need to do anything more than we already do, which is be a partner in determining the placement of monies for applicants to this loan program. And again, I encourage you to ask Dr. Withy her opinion.
So just Lauren, just to clarify then, this section 4 that talks about the loan repayment program that deletes the medical school and adds Department of Health, you're saying that it should stay with JABSOM, and you can add Department of Health, but JABSOM should not be deleted from that section. Is that what you're?
Yes, Senator. The program that we have now, the reality we have now, that continuity should be allowed to exist, which is essentially practically, and in reality, JABSOM runs this program and they do a bang-up job. We would just get in the way, but we're already at the table, so we don't mind being a silent partner. And again, I would recommend that, you know, you could repeal the Hawaii Health Corps program and just replace, and I don't think there would be much substantive change in what's going on, other than to make sure JABSOM has enough money to continue to capitalize their loan fund.
So you're saying that going back to section 3, the Hawaii Rural Health Program, the Health Corps program, is that a grant, or is that being run by anyone, or is it just sort of on paper?
I believe it's just on paper. Again, I'll ask Kelly to comment on if the statute actually is, if any activity is sanctioned by that codified statute. So if I may turn it over to Dr. Withy.
So I don't believe that the Hawaii Health Corps is actually funded or doing anything right now. But through the same partnerships described, we do have the Hawaii State Loan Repayment Program. The money goes to Department of Health, because if you give money to UH, it's maybe distributed differently. And so I don't know how to say that, right? But this way it comes directly to the purpose and is only spent on loan repayment, not even on administration or anything. We've had 64 loan repayers so far, and we have very good retention rates. But I believe we have different bills going through to fund that program as well. So I would think if we combined the two, we could make them a wonderful program.
So right now, the way that the bill reads, or the way the Health Corps reads, the administering agency is it Department of Health or is it JABSOM? The
JABSOM
health board.
JABSOM administers, funds go through Department of Health.
So there are two on paper, and one is operational. The loan program is operational, but it would be to fund those people or give loans to those people who are in the Health Corps program. Is that correct?
No, the Health Corps program is not active right now because
But
it was.
if it were, would it be the same people or a separate program?
If we could arrange that, that would be perfect, I think, because we do have psychologists and social workers in our loan repair pool. And so I think that if we combine these two efforts and we can bring in more decision-making from social work and psychology, I think it'll make it a stronger program. I think having one, it would be best. And that also uses the federal matching money.
And one last question, it broadens it to psychologists and social workers to add to the pool of people, I guess, who qualify for or will be part of the Health Corps should it become operational. Is that, and that's agreeable to both of you?
We've already funded 3 psychologists, a social worker, and a marriage and family therapist. So that is part of our program already.
Okay, thank you, Chair.
Okay, members, any other questions? Okay, seeing none, we'll move on. The next measure is SB 2804 relating to pools. For purposes of the Department of Health's authority to adopt rules concerning public health and safety, this defines pool to mean a watertight artificial structure containing a body of water that does not exchange water with any other body of water, either naturally or mechanically, used for swimming, diving, recreational bathing, or therapy by humans. First and only testifier in support, Department of Health, Mr. Oshiro.
Aloha, Chair, Vice Chair Baker, Senator Kehokolole, members of the Senate Committee. The department stands on its written testimony in support, and I'm available for any questions.
Thank you very much. That's the only testifier we have signed up. Is there anyone else who'd like to testify on this measure? Okay, seeing none, members, are there any questions? All right, we'll move right along to the last measure on this agenda, SB 2829, relating to mental health. This establishes provisional or associate level licensure requirements for marriage and family therapists and psychologists, and authorizes insurance reimbursements in certain circumstances. It also allows psychologist license applicants to sit for the licensing examination before completing other requirements. First, we have the DCCA offering comments.
Good afternoon, Chair Kehokolole, Vice Chair Baker, and members of the committee. My name is Rasha Araki. I'm the Executive Officer for the Marriage and Family Therapy Program and Social Worker Licensing Program. On behalf of the department, I will stand on the written comments. While the department appreciates the intent of this measure, the creation of this new license type appears contrary to the provisions of Hawaii Revised Statutes Section 26H-2, which provides in part that the regulation and licensing of professions and vocations shall be undertaken only where reasonably necessary to protect the health, safety, or welfare of consumers of the services. The purpose of the regulation shall be the protection of the public welfare and not that of the regulated professional vocation. A new licensure scheme should not be implemented for purposes of reimbursement only. Furthermore, these could have unintended consequences such as higher costs for services rendered and could be passed to consumers. Thank you.
Thank you very much. Department of Health.
Good afternoon, Chair, Vice Chair, and committee members. I'm Dr. Janelle Hernandez-Armstrong from the Department of Health, and I appreciate the opportunity to testify in support of SB 2829. I've submitted written testimony. I'd just like to add that we're currently facing several job openings, both for psychologists within our department and for master's level clinicians who provide services to the youth within our community. We often have this difficulty. It's a continual problem that we face, maintaining strong providers for our youth. And a lot of that is due to just being able to maintain people in this community because of financial stressors. The youth of our community deserve the best mental health that we can provide. And I think this bill would accomplish that goal by keeping and bringing much needed mental health professionals to our state. Additionally, many other states use these provisions, and I myself had a license as a postdoctoral trainee and was able to obtain my license by sitting for the exam prior to completing my postdoctoral training. So I just feel like a lot of the existing laws are preventing us from being able to get mental health providers in our state, and we're severely understaffed in that area, and our youth need more, as do all the other members of our community. And we stand on the remainder of our testimony. And I'm available for questions as well. Thank you.
Thank you very much. Next, we have the Hawaii Department of Public Safety offering comments. Okay, CBT Jim, Mr. Miller offering comments.
Okay, hello. Good afternoon, Chair, Vice Chair, and committee members. I'm Justin Miller, a licensed mental health counselor. Thank you for the opportunity to give testimony here. My message is a simple one of fairness and inclusion. I respectfully ask that licensed mental health counselors be included in this bill. My marriage and family therapy colleagues make frequent mention in their written testimony of not letting mental health be an afterthought. I completely agree, and I implore you to not let mental health counselors be an afterthought in this mental health bill. In my written testimony from page 33 onwards, the work has been done to make this easy to do. You will find an update which includes licensed mental health counselors. Please don't penalize the people of Hawaii or the licensed counselors or the students training in mental health counseling just because as a group, mental health counselors weren't well funded with lobbyist support. For those who say pass the bill anyway, I think this is wrong. For those who say pass the bill now and think about counselors later, it will be easy to add them later. I say this is not at all true. The evidence doesn't support this. Legislation is never easy and takes time to pass. So please, I urge you all to do the right thing. It's easy. Please use the updated version of the mental health bill found in my testimony that includes mental health counselors. I'd also just like to note briefly, states that have associate licensure do not exclude counselors. Passing this mental health bill without including our state's valuable licensed mental health counselors would be an embarrassment to Hawaii and would create an unhelpful tiered mental health system which would fragment the care available and go against the very spirit of this legislation. Thank you.
Thank you very much. Next, we have the Hawaiian Islands Association for Marriage and Family Therapy in support.
Aloha, Chair, Vice Chair, Committee. Mahalo for hearing my testimony. I just want to offer that a couple of numbers. In Hawaii, it's 320 to 1. In Honolulu, it's Hawaii Island specifically. Honolulu, 370 to 1. Kauai, 480 to 1. Maui, 550 to 1. And on Molokai, there are no registered providers. And these are all the ratios. The first number is the number of clients, and the second number is to each therapist that is available across the island. So clearly, the demand for services far exceeds the viable supply of local mental health providers. And even before the pandemic, we were facing a shortage of about 10,000 full-time equivalent providers across the country. And some estimates put that now around 15,000. And it is my belief that the associate level licensure that is insurance reimbursable is the most efficient means of meeting our state's mental health needs. We have talented post-degree pre-licensed therapists who either leave the state or leave the field because they can't earn a living during the 12 to 24 month post-degree clinical experience period, and or afford to pay for supervision that can cost anywhere from $10,000 to $30,000. I have personal experience with this here in the state with an MFT post-degree pre-licensee who was trying to start a therapy program using Olelo Hawaii, and we had to close that program because we couldn't afford to keep it going. As has been mentioned, fortunately, 23 other states have already done this, and we're not reinventing the wheel, we're just modernizing it. Thank you so much for hearing my testimony. I yield the rest of my time.
Thank you. Next, we have the Hawaii Psychological Association in support.
Aloha, Chair Keohokalole, Vice Chair Baker, members of the Senate Health Committee. My name is Becky Gardner, testifying on behalf of the Hawaii Psychological Association. I'm delighted to be here to testify on this bill, although I would have preferred some of our psychologists to be here before you right now, but there is a Board of Psychology meeting happening currently. So I'm in their stead, but I think this is a really interesting case in point, because one of the things that this bill does is address one of the unintended consequences of a law that's on our books that requires state psychologists. They can be hired, but if they don't get their licensure within 2 years, they have to be fired. And that actually happened during the pandemic because the Board of Psychology wasn't meeting in time to give these people licenses. So we are losing people based on some pukas in the law. And so the way I see this bill, I can't say that it's complete because, you know, we're hearing from mental health counselors that they want to be represented as well. But in a way, it sort of represents the bucket of demand for mental health services. There's great demand, as we've heard, and we're trying to fill that bucket with a supply of providers. Our bucket are our laws, and there are some holes in it. We're losing some people to the mainland because they can get paid for that pre-licensed work. We're losing people to the mainland because they can take the test over there and maybe decide to stay. There are certain requirements, you know, perhaps someone has emergencies in their family and they can't keep up with doing free work while raising a family or doing some caretaking. So there's a lot of little fixes in this bill that we encourage the committee to look at carefully. I also note that this is a low-cost bill. It's self-funded. It'll be, you know, there's no appropriation in this bill. It's going to be drawn from licensing fees. Yeah.
Thank you very much.
Okay, sorry.
Next, we have the National Association of Social Workers.
Aloha, Senators. Thanks for having us today and for hearing this bill. It does a lot of things. So first of all, this isn't a radical or revolutionary idea. We already do this in social work, right? So there is a model for this in the state. We have an LSW exam, which is our postmaster's level exam. And we want that to be offered to our allied professions as well, so that there's an ability to be licensed and to be garnering your experience. What isn't clear in our licensing law, and this law actually helps to clarify, is that some of the health insurance companies read it that an LCSW who is supervising an LSW can bill under their own license. And some of the health insurance companies read it as that's not allowed. So this bill fixes that and allows for supervision of an LCSW supervising an LSW and then being able to bill for insurance for that, which allows for more one-on-one contact and in-person supervision with therapy. So a lot of our providers graduate, they end up in larger scale practice, they end up working for agencies and don't get as much experience doing the clinical work that we'd like them to be doing because there isn't a mechanism to pay them for that work. So this helps to do that and helps with the brain drain from our state. And you know, it's something that has been in the works for a while. We've been working with the other agencies to do that because honestly, all of our providers are maxed out. Everyone, the pandemic is, I mean, exhausting as a community, but as a community of mental health providers, everyone is full. Everyone has waiting lists. This is something that will accelerate our ability to open up the pool to, you know, to see more people in our community, to take more people on for mental health care and for treatment, because we have people who are trained, who are graduated, who are in this time period. You know, for social workers, it's between 2 and 5 years. It's a number of hours that you have to receive. So we have people who are already in there who we could activate to be seeing clients, to be, you know, to be providing care in the community. And this would allow us to do that and really activate more people to help in the community as well as with our allied professions. It would create what we have for them, which is this ability to have this intermediary license. So you're fully trained, you've done all of your grad school, and now you're under the supervision of a higher level clinician. For us, it's the LCSW. Thanks again, and I yield the rest of my time.
Thank you. Next, we have Wellness Partners Hawaii Incorporated in support.
Hey there, committee. My name is Bradley Kuo. I'm the owner and provider for Wellness Partners Hawaii. We have 11 therapists in our group, including psychologists, LCSWs, LMFTs, and LMHCs. We submitted our testimony, stand on that testimony, and we are available for any questions. We are in strong support. Thank you.
Thank you very much. Let me see. Toby Broidel, offering comments.
Yeah. Sorry, one second. I don't have anything new to say, really. I just want to echo what some people have said before. I believe that this is a pretty serious mental health crisis in the state. I live in Hilo personally, and I see a lot of people just like out on the street. You know, there's like rampant drug addiction, mental illness, and I just don't think that there should be any barriers to services. And that would also necessitate adding mental health counselors to this bill, just to kind of expand the realm of services that would be available. All right, thank you.
Thank you very much. Next we have Samantha Bilo. In support.
Good afternoon, Chair and committee members. My name is Samantha Balo. I'm in support of Bill 2829 with the language change to add mental health counselors. As a case manager at a mental health agency in our local community of Hilo, I'm aware of the massive need for mental health clinicians in both Hilo and the whole state. I'm also a master's student at the University of Hawaii, Hilo. The counseling psychology program prepares us to work as mental health counselors in the state of Hawaii. If this bill is to increase access to mental health services, then it is imperative that mental health counselors are not left out of this bill and language is changed to add us. An amendment has been submitted as testimony by Justin Miller, LMHC in the state of Hawaii, that I strongly support. In many other states, a provisional license is granted once passing a state exam, then hours are accrued for up to 2 years and you apply for your state license. In the state of Hawaii, we don't have a provisional license yet. The consequences to our community due to this gap in licensure are endless. Many private and group practice providers are unable to hire unlicensed providers because they cannot bill insurance companies for their services. This means graduates are typically forced to take low, underpaid positions in larger agencies, and some of these are wonderful positions, but the options are limited. 30% of these graduates wind up leaving the field due to not making enough money to support themselves. If this bill is intended to increase access to mental health services, that it is imperative that mental health counselors are not left out of this bill. Thank you for your time, Samantha.
Thank you very much. That's all the registered testimony we have. Is there anyone else that would like to testify? Okay, seeing none, I'd like to note, in terms of written testimony, there were 41 individuals or organizations who testified in support, 9 in opposition, and 40 who submitted comments. Members, any questions? Okay, seeing none, let's recess for decision making. Recess. Okay, we are reconvening for decision making on the Friday, February 4th, 1 p.m. agenda. First measure on the agenda is SB 2280 relating to dental assistants. I'm going to recommend that the committee accept the Department of Health amendments in section 2, which changes the term employed in a public setting to provide services in a public setting. And also accept the Oral Health Coalition amendments in section 2 relating to supervision of a dental assistant working under a licensed dental hygienist instead of a licensed supervising dental hygienist. Also, there are some technical non-substantive amendments, and we're going to recommend we defect the effective date to January 1, 2050 to encourage discussion. Any comments or questions, members? Okay, seeing none, Vice Chair, SB 2280 passing with amendments. Chair votes aye.
Votes aye. Senator Moriwaki. Senator Moriwaki. Excused. Senator San Buenaventura.
Aye.
Senator Favela. Senator Favela, you're muted.
Aye.
Chair, your recommendation is adopted.
Thank you very much. Next measure, SB 2439, relating to hearing aids. I'm going to recommend that we accept the HMSA amendment, changing the fixed dollar amount in the bill to an amount to medical necessity, as noted in the testimony, and defect the effective dates January 1, 2050. Any comments? Okay, seeing none, Vice Chair, SB 2439, passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki. Excuse. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's adopted.
Thank you very much. The next measure, SB 2440, relating to tobacco use disorder treatment. I appreciate the testimony. In light of the fact that it appears from the Hawaii Substance Abuse Coalition that tobacco use treatment is offered to clients already, I'm going to recommend that we defer this measure. Next measure, SB 2460, relating to nurses. The recommendation is to defect the effective date on this measure, move it out with amendments. We also have some technical non-substantive amendments and defect the date to January 1st, 2050. Any comments? Okay, Vice Chair, SB 2460, passing with amendments. Chair votes aye.
Vice Chair votes aye. Are the other members on the call, San Buenaventura and Favela, opposition, in support? I will take no comments as a support. I'll cast aye ballots for everybody that's available, and Chair, your recommendation's adopted.
Thank you very much. Next measure, SB 2592. I'm going to defer decision-making on this measure to Monday, February 7th at 1:10 p.m. The next measure, SB 2751. This is the loan repayment measure. You know, after hearing the testimony, it seems to me that the existing JABSOM loan repayment program can facilitate the aim in this bill. And there is a bill related to that I do intend to schedule, so we're going to defer this measure.
2751, 2751, you're deferring? Okay.
Yes. Okay, the next measure, SB 2804, relating to pools. I'm going to recommend that we move this bill with technical non-substantive amendments. Any comments? Okay, Vice Chair, SB 2804, passing with amendments. Chair votes aye.
Vice Chair votes aye. Are the other members on the call, any objections or reservations? Okay, I note the absence of Senator Moriwaki. Chair, your recommendation is adopted.
Thank you very much. The next measure is SB 2829, relating to mental health. The recommendation is to add the requested amendments related to mental health counselors. So we'll add mental health counselors into the bill and defect the effective date to January 1, 2050. Any comments? Okay, seeing none, Vice Chair, SB 2829 with amendments, Chair votes aye.
Vice Chair votes aye. Are the other members on the call, Senator San Buenaventura and Favela, any no votes or reservations? Hearing none, Chair, your recommendation's adopted.
Thank you very much. We're going to move to the decision making on the 1:10 p.m. agenda. This is a bill that was deferred for decision making from Wednesday, SB 3118, relating to tobacco products. I'm going to recommend that we move this bill with an amendment, with two amendments, one to better clarify the definition of hazardous waste, and the other to exempt chewing tobacco, cigarettes, and cigars from the flavor ban. I'm also going to recommend we defect the effective date of this measure to January 1, 2050 to encourage further dialogue. Members, any comments or questions? Okay, seeing none, Vice Chair, SB 3118, passing with amendments, Chair votes aye.
Chair votes aye. Senator, Vice Chair votes aye. Are the other members on the call? Any reservations, no votes? Chair, your recommendation is adopted.
Thank you very much.
Chair, did you, what was your recommendation on 2592? Did we do that one?
2592, we're going to defer decision-making to Monday.
Okay, got it. Thank you.
Okay, members, have a great weekend. We are adjourned.